North Carolina health leaders say they may have to start cutting Medicaid reimbursements next month if state lawmakers can't approve more funding. Lawmakers are working on a deal to increase funding, but they're hung up on some other provisions, like funding for the state's first standalone children's hospital. WRAL's Destiny Patterson explains.
The House and Senate are at odds over whether a package to fund Medicaid should also include funding for the state's first children's hospital in Apex. Health leaders approved some funding for the project in 2023, but right now legislative leaders are fighting over whether some of that funding will be paid out. Members of the state Senate say they want it in the package, and Senator Michael Lee says they're just asking for about $100 million that the chamber has already agreed on in 2023.
There are folks that have already been expending money and moving based upon our commitment to that aspect of healthcare in North Carolina. The Children's Hospital, it can't, in my personal opinion, it can't get here fast enough.
House leaders say Medicaid is the most pressing issue and that funding for the Children's Hospital should be negotiated separately. If the health department doesn't receive more funding, it could start cutting reimbursements as early as October 1st. Some House members are now public with their frustrations. That includes Representative Grant Campbell. He posted a video on social media over the weekend blaming the Senate for holding up negotiations.
The House stands ready to appropriate the full amount of funds, and we're asking the Senate to join us and not attach any other unrelated projects.
Senator Lee says he hopes the House and Senate can strike a deal next week when lawmakers come back to Raleigh. Destiny Patterson, WRAL News.